Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on innovative medicine. I'm your host, Ashley Russo, and we have a unique show for you this evening. We're exploring pediatric orthopedics at St. Luke's University Health Network, and we'll be joined by a talented panel of experts from the field. Stay tuned. This is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at pediatric orthopedics at St. Luke's University Health Network. Stay tuned. Thanks for being here. Let's get started. We have a skilled panel of guests joining us tonight. Up first, we have Dr. Nicholas Grimm, a fellowship-trained orthopedic surgeon specializing in pediatric orthopedics. Dr. Grimm completed medical school at Lake Erie College of Osteopathic Medicine and his internship and residency in orthopedic surgery at Philadelphia College of Osteopathic Medicine. He then completed a fellowship in pediatric orthopedics at Washington University Shriners Hospital in St. Louis, where he received extensive training in general pediatric orthopedics, including trauma, sports medicine, and hip dysplasia. Thanks for being here, Dr. Grimm.
Thanks for having me.
So as a pediatric orthopedist, you actually see children from newborn all the way up through the teen years. That's a pretty vast field. What made you go into this field and specialty?
So I think first and foremost, during my training, just working with children, I always felt that that was the most rewarding and the most fun aspect of what we do. I think with kids, you get the unique opportunity to treat a really broad scope of pathologies. And kids are great patients. They're motivated to do well, and they generally do well, which makes my job easier, and it's really a rewarding field.
As they say, kids are pretty resilient usually,
Yes.
So I'm sure that's rewarding.
So.
Well, thanks for being here. Joining our panel next is Dr. Dustin Greenhill, a board-certified orthopedic surgeon specializing in childhood and adolescent conditions with an expertise in scoliosis and pediatric orthopedic trauma. He is a graduate of the U.S. Military Academy at West Point. Dr. Greenhill completed his medical degree and residency at Temple University. He then pursued his fellowship in pediatric orthopedic surgery and scoliosis at Scottish Rite Hospital for Children, one of the most highly ranked pediatric orthopedic surgery programs in the country. Thanks for being here, Dr. Greenhill.
Thanks.
Tell me about the unique training that comes into play to become a pediatric orthopedic surgeon versus an orthopedic surgeon.
For the most part, every orthopedic surgeon should come out of initial training capable of doing the same things, but then certain people practice within certain realms: sports, joint reconstruction, upper extremity. Most of those realms are largely adult patients and very few childhood patients. So Dr. Grimm and I specialized in pediatric orthopedic surgery, where we took what we already knew about orthopedic surgery and we learned and figured out how to do it better in children.
Excellent. Let's meet our final panelist, Lisa Nicola, a board-certified pediatric physical therapist. She graduated from Marquette University with a bachelor's degree in physical therapy and received her master's degree in business administration from Loyola University, Chicago. She earned her doctorate in physical therapy at A.T. Still University of Health Sciences. Lisa specializes in pediatrics and enjoys working with children of all ages to develop optimal health, wellness, and function through movement and exercise. Thanks for being here, Lisa.
Thank you for having me.
As a pediatric physical therapist, you work with children to help them achieve wellness, function, and developmental milestones. What gives you the most satisfaction in what you do?
Developing relationships with the families and the children. It's wonderful to be able to watch the children improve in their functional skills and be able to participate out in the community and in the recreational activities.
Yeah, because children coming in really is a full family experience, I would imagine, for you and your department.
It is.
Excellent. Well, thank you all for giving us some great background information on your expertise and your practices. Next, we'll dig deeper into pediatric orthopedic services available at St. Luke's. Stay tuned. We'll be back after a short break. You're watching St. Luke's Health Now.
At St. Luke's Orthopedic Care, you can trust us with your hands, feet, shoulders, hips, and knees. Because healthy bones and joints mean you can do more. You can trust us to recommend the right approach to care, including joint-sparing treatments and therapies. And when surgery is the only choice, we offer options to help you heal faster, including technology-assisted joint replacements and muscle-sparing hip surgery. St. Luke's, the orthopedic care you trust, now more than ever.
Hi, my name is Avery Valentin. I'm a sophomore at Penn State University, and I recently just had spine surgery. My back has always kind of hurt, especially in the latter years of high school. So the back pain really took me away from friends and hanging out and spending time with them, and it definitely made me feel very anxious and upset that I was in pain and I couldn't enjoy time.
Avery was complaining more and more about pain and just sitting there. And when we took a trip to Mexico for a family vacation, I did notice that you could really see the different curvature in her body. We took a trip to my chiropractor, and he did seem to think she had a little bit of possible scoliosis. So we said, yeah, we're definitely gonna have you take a look. Let's see what's going on.
We went to Dr. Greenhill, and he told us we needed surgery. Hearing that I needed spine surgery was really scary, but Dr. Greenhill instantly made me feel so comfortable, and he right away was cracking jokes with me. The team at St. Luke's, they were absolutely amazing. They are so caring and so genuine, and they really just want the best for you. So since surgery, I've had very minimal pain in my back. Some activities I could enjoy now, definitely yoga. I couldn't really bend my body before surgery, so now I'm capable of doing that, so it's really awesome to finally move. I can now enjoy a pain-free life.
I would recommend St. Luke's for orthopedic care because they are top of the line surgeons. I couldn't have asked for a better surgical team for my daughter Avery.
Welcome back. Thanks for being with us tonight. I'm Ashley Russo, and this is Health Now. We want to thank our viewers for watching our program tonight and for providing us with questions for our panel, which we'll get to later in the show. Joining me is a talented group of medical professionals, Dr. Nicholas Grimm, Dr. Dustin Greenhill, and Lisa Nicola. We've learned about their expertise, so now we're going to dive deeper into pediatric orthopedic services available at St. Luke's. All right, Dr. Grimm, I'm going to start with you. Can you tell us about the different musculoskeletal conditions that you might see and what are orthopedic issues that could be present at birth?
So as pediatric orthopedic surgeons, we see kids from newborn all the way up until age 18. Pretty much anything orthopedic in children falls under that umbrella. So that could be anything from hip dysplasia, club feet, all the way to trauma, leg length discrepancies, things like that. The things that are present at birth, the big things that we screen for and look for would be club feet and hip dysplasia. They're best treated early. So sometimes treating things early can really be the difference between a small casting or small bracing versus a big surgery later on. So those are the big things we screen for.
And I would imagine finding things early is a huge key in children recovering properly.
Absolutely, absolutely. And it also makes a huge difference with the parents feeling like the kids are getting treated correctly from an early age.
Well, speaking of getting treated correctly early on, Dr. Greenhill, you specialize in spinal abnormalities in kids. Can you tell us a little bit about what are the most common spine-related conditions, and do patients need surgery from those?
The most common pediatric spinal condition is scoliosis. And there's many different kinds of scoliosis. 100,000 children per year in the U.S. are diagnosed with scoliosis, and less than 1% of them actually need surgery.
Well, that's pretty good information because the odds are in your favor that your child will not need surgery, and so it may be not to be so fearful of that diagnosis.
Yes.
Well, a lot of times that diagnosis requires physical therapy, so Lisa, let me turn to you. What are some of the common conditions that a pediatric physical therapist treats, and is there a certain age that children really are supposed to be in order to receive physical therapy? When can they participate in the process?
We see children from birth through adolescence. So as an infant, as Dr. Grimm mentioned, we'll see children with club feet or hip dysplasia. And as children get older, we'll work with children who walk on their toes, maybe have some in-toeing, lower extremity injuries or muscle weakness, muscle tightness. We also see children with cerebral palsy or arthrogryposis.
How often are parents concerned that physical therapy maybe isn't right for their child? Is it hard for you to convince them that this is what they need to do?
Usually not. Usually the doctors refer them, and there's usually a reason why they're coming, and often the parents have a lot of concerns that they would like addressed.
When you're talking about the parents, Dr. Grimm, how important are the parents and the family in the process when a diagnosis has been made early on?
I think it's very, very important. I mean, having buy-in from the whole family is what makes a difference between a good outcome and a bad outcome. Obviously, the kids aren't bringing themselves to the appointments. They're not always going to be 100% compliant with the casting or the bracing or the stretching. So it really is up to the parents to play a big role in making sure that, you know, the outcomes are good.
And Dr. Greenhill, if a child does need surgery, what does that journey look like for a family? And similar question to Dr. Grimm, how important is that family and parent participation in the process?
Everyone is part of the team. I tell them once we sign up for surgery, you have opened the door to just being part of our family, to be honest. And there's a lot of things that start happening. Once you decide to proceed with surgery, the office starts working with your insurance company, starts working with the kid's parents. We have a whole protocol in place specifically for scoliosis where you get preoperative optimization, pulmonary function test. The pediatric anesthesia staff at our hospital starts reviewing your chart and talking with the surgeons to make sure that surgery is going to go well. There are 1,000 things that happens once you start.
When a child is recovering from surgery, do they need physical therapy? And when are some times that you might refer patients to PT and Lisa's group?
Most kids after surgery recover very quickly without physical therapy, actually. There's certain things, certain injuries, certain joints that we operate around for kids that absolutely benefit from physical therapy in terms of regaining your motion quickly. We want kids back in sports as soon as possible.
Lisa, when a child is referred to you, what do you and your team do to earn their trust, not just the child, but the parents and the family coming along for that journey?
We try to remember that the parents are the experts on their child. And so I think it all starts with the parent interview and spending time listening to their story about their child, their concerns for their child, and then what goals they have for their child in therapy.
It's really interesting because I'm hearing all of you say how important the parents and the family are and what a part of the team they are from the very beginning, and I think that that's very comforting to know, so great information from all of you. We're not done yet. After the break, we'll learn more about new technology and treatments offered at St. Luke's. You're watching St. Luke's Health Now. Stay tuned.
The team that we have put together of sport performance coaches and athletic trainers is why parents should choose St. Luke's University Health Network for their sport performance needs.
St. Luke's and our coaches are going to provide the safest and most comprehensive training environment that a student athlete would want. And I don't think there's anything in this area that can rival it.
Hi, my name is Brittany Mickey, and my son Cole had clubfoot when he was born. Clubfoot is when they're born and their feet are turned inward, and then they do a series of casts to correct it to turn them facing outward. We first discovered that Cole had clubfoot when I had my 20-week ultrasound. Hearing that, it's definitely very scary because we've never heard of it before. So the doctor just briefly explained it, and then he recommended that we meet with Dr. Grimm pre-birth so that way we could find out all the information and come up with a plan. He was very friendly, very knowledgeable, very empathetic. He told us, how he has kids, so he was very relatable. We were very excited. He said that Cole would walk, run, jump, skip, do everything that kids would do. So after our first meeting with Dr. Grimm, I had no worries the rest of my pregnancy, which was great. After the 5th cast, his feet were fully corrected and he went into his boots and bar, which is what he's in now. Cole is doing great today. He did all of his milestones when he's supposed to. He's running, he's lapping, he's trying to talk, so he's doing amazing. Everyone is amazed at Cole's progress. Every week I would actually take a photo and it was awesome. You would see his feet, even from the first week, they started to move, which was amazing. And so every week I would post it on my social media and everyone would be so excited and amazed because not a lot of people have heard of clubfoot. So it was a great way to get the word out and give it some positive reinforcements, so that was great. I would definitely recommend St. Luke's to expecting mothers. All of the doctors that I have dealt with are so empathetic, so knowledgeable and friendly, and they really do care for you. I've had great experiences there.
Welcome back to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on innovative medicine. I'm your host, Ashley Russo, and we have an interesting show for you tonight. We're discussing pediatric orthopedics at St. Luke's University Health Network. In case you're just tuning in, I'm joined by 3 St. Luke's medical professionals, Dr. Nicholas Grimm, Dr. Dustin Greenhill, and Lisa Nicola. Thank you all for being here. In the first part of the program, we learned more about you and your subspecialty, as well as different things that you treat with children in orthopedics. Now we'd like to dive a little bit deeper into some of the new technology and the treatments offered at St. Luke's. Dr. Greenhill, I'll start with you. I understand that you performed the first limb lengthening procedure in the region, and it was with a device called the Precise Nail. Can you tell us what is limb lengthening, when is it recommended, and how does this procedure work?
So limb lengthening is when you have a limb length discrepancy. I specialize in pediatric orthopedic surgery, but also scoliosis. Oftentimes somebody comes in with scoliosis, they actually have, their legs are very different lengths and their spine looks crooked because of that. And so if you have a limb length discrepancy of a certain magnitude, it can be symptomatic. It can bother patients. You can have issues going into adulthood. And so if you have legs that are different lengths, you can either shorten one leg, you can lengthen the other leg. And very commonly these days, if your growth plates are closed and we can't do minimally invasive procedures, we're having to lengthen a leg. That was uncomfortable before this implant was available. The Precise Nail is a nail with a magnet inside. It's an intramedullary, so meaning inside the bone, lengthening device where you implant it through minimally invasive incisions, but then over the next, say, month or whatever your goal is to lengthen that leg, you slowly grow the leg and nobody knows the implant's even there until the leg is the length that you want it to be as it heals.
That's pretty incredible, and it sounds like a lot less pain and probably quicker recovery from that, I'd imagine.
Oh, it's much more comfortable. The classic way this was done when orthopedists started lengthening limbs is to put an external fixator with rings and wires coming out of your leg. And we can still do that in certain complex deformities, but if you have a straight bone that needs to be straighter and longer, we can implant all the devices inside now.
Absolutely incredible. So great to know that there's such an advancement in that kind of treatment available at St. Luke's. Dr. Grimm, clubfoot is one of the most common orthopedic issues in infants. Can you explain this condition and tell us about the treatment options that are available today?
So clubfoot is one of the most common musculoskeletal conditions that kids are born with. Typically it is something that can be diagnosed in utero. The prenatal ultrasound will often pick it up, and when that happens we actually schedule a prenatal consultation with the parents to discuss what clubfoot is, kind of go over the natural course, and also go over what to expect as a treatment protocol. It's a multifactorial condition that has a genetic component to it, but we don't know exactly what causes it. It's a tightness of the muscles and ligaments that result in a lower extremity that's a little bit deficient, but also characteristically a foot that kind of comes in this up and in position. The tide has really changed over the past 30 years to do a casting protocol called Ponseti casting, and that's something that we do here at St. Luke's. I had pretty extensive training in my fellowship with one of the the world leaders in clubfoot, Dr. Dobbs, and he's actually created a few braces and things that I use in my office. But basically we'll bring the kids in sometime in the first month of life and start the casting protocol. It's weekly casts in a very specific position. Usually it's about 4 or 5 casts, so it's not a one and done thing. We're following these kids till they're, adults, but actually most kids do really well with the casting, and it's really rewarding to be able to see kids get up and walk.
And amazing to know that if you are a parent and you get that diagnosis, especially in utero, there's such a great way to fix it that isn't a major surgery. So while it is a long time, I think that's very comforting.
Right, and I think one of the things too I found when I started here 3 years ago was a lot of these patients and parents were driving to Philadelphia, to New York City, and they were going every week for the first month, 2 months of the kid's life to get these casts placed. That's a lot. Most parents can't really afford to do that, so we can do that now closer to home, which is great.
Excellent. Lisa, I want to turn to you and ask you, when are some times that patients and children are referred to you from a pediatrician. Maybe they haven't seen a surgeon, but the pediatrician notices something that perhaps your team can be helpful with. Can you tell us about some of those situations and conditions that you might get referrals from the pediatricians?
We'll get the referral, we'll bring the child in, we'll perform an evaluation and listen to the parents' concerns, and then at that point perform some tests and determine the child's limitations, their strengths, and then try to determine a plan of care, with the family. And that may require a referral to orthopedics, depending on the child's needs at that time.
So if a parent is referred to see pediatric physical therapy, should they just embrace it and go, or should they be concerned? What is your advice to parents?
We see children through direct access, so most insurance companies will allow the patient just to come to us without a physician referral. But after 30 days, if we are finding the child's not improving, or if we have specific concerns or red flags, we will then refer to a medical provider.
Excellent, good to know. Dr. Greenhill, we've got another cool innovation over at St. Luke's, because I understand it's the first in the nation to use in-house 3D print and innovation lab producing something called active armor. So these are plastic casts. They're used for common, breaks and fractures of the wrist and forearm. So what makes these casts so great, and how are they different than the classic heavy cement type cast we're used to seeing?
Yeah, so the Active Armor is a company invented by a woman who realized that casts get dirty quickly in children, and so and athletes. We are using these Active Armor casts. You get a 3D scan of the arm. If it's a stable injury, and you can remove the cast to wash your hands or take a shower, but you want that kid to wear it when they're at school or when they're playing or when they want to go in the pool. This Active Armor cast is a 3D printed cast that is basically a cast that you can temporarily remove, clean, and put right back on. It can't get too dirty because you can always clean it.
Dr. Grimm, I want to ask you about hip dysplasia, understanding that that's much more common in girls. How easy is it to diagnose, and how important is it to treat very quickly?
You're right, hip dysplasia is more common in girls. There's several risk factors that we look for. Firstborn female, breech presentation in utero, so breech positioning, and then a strong family history. Hip dysplasia is typically diagnosed either by clinical exam when the child's born, and if there's concern on that clinical exam, then we'll get an ultrasound to further evaluate. But hip dysplasia is a spectrum. It's anything from a hip that's a little loose and a little underdeveloped to a hip that's all the way dislocated. We kind of consider that all hip dysplasia. The great thing about hip dysplasia is if it's picked up early, then it can be treated rather minimally invasively with something we call a Pavlik harness. So it's a dynamic harness that babies wear to kind of gently position the hips in the right position. We know that over time, if the hip is positioned in the socket correctly, the babies will kind of tighten that up on their own. So treating it early, picking it up early is very important.
It's amazing to see how much innovation there is in this field, and I think it's important for parents out there that are watching this show to understand that they shouldn't ignore something because help is available at St. Luke's. So thank you all. That is amazing technology and techniques that you're using. Up next, a question from our viewers. Stick with us. You're watching St. Luke's Health Now.
St. Luke's has been a cornerstone of the Lehigh Valley for over 150 years. It was originally founded to provide industrial workers with immediate local access to care. In the last century and a half, while healthcare has transformed dramatically, St. Luke's dedicated physicians, employees, and volunteers have proven they can respond to changes with exciting, innovative, and bold healthcare solutions. St. Luke's ability to deliver the highest quality care at the lowest cost is truly transformational and will ensure our future.
Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. A special thank you to our outstanding panelists. We've had a great conversation about pediatric orthopedics at St. Luke's University Health Network. Now we're going to take some questions from our viewers. All right, Lisa, I think this one is for you. What kind of therapy would be prescribed for an infant who has limitations with crawling and walking? Common concern with parents. When should they crawl? When should they walk? When should they get physical therapy?
First of all, there's a wide variation of when it's appropriate to crawl and walk. Some babies never crawl and scoot on their bottoms or scoot on their bellies and then proceed right up to standing. But if a child's over a year, that is a little bit more concerning, and that we would recommend physical therapy to try to find out the reasons why that child is having difficulty achieving those milestones.
Excellent. All right, Dr. Grimm, I'm going to throw this one to you since we talked about clubfoot earlier in the show. This viewer writes, my son was born with clubfoot, which was successfully treated as an infant. As he grows older, will he have any restrictions with activities, and do you have any advice?
As far as restrictions, no, none. I always tell the clubfoot parents and patients, I'm never going to hold you back from anything. Whatever you can do, you should do. And actually, most clubfoot patients that are treated successfully as an infant have no limitations, no restrictions. As far as advice goes, stay active, stay flexible, and then regular follow-ups with a pediatric orthopedist just to maintain those lines of communication and address problems early if they pop up.
Excellent. Dr. Greenhill, this viewer writes, I have a daughter, age 10, who is diagnosed with a curvature of the spine. I was told it's a mild case. Should she start seeing a pediatric orthopedic surgeon now, and will this resolve on its own as she grows?
There's many different kinds of scoliosis or spinal curvatures. There's a lot of reasons other than scoliosis that cause your spine to curve. So I definitely think they should be evaluated by a pediatric orthopedic surgeon. Scoliosis is defined as a curve greater than 10 degrees. It's severe when it's greater than 45 or 50 degrees, so there's a lot of room in between. You shouldn't worry. If it's a mild curvature, there's a chance that everything's going to be fine. And then along the way, you need to make sure that the child doesn't really have risk factors for progression. If they do they need treatment? So the answer is yes.
Okay, Lisa, this question is for you. My 7-year-old child has pain when running. Would pediatric physical therapy help him?
Yes, we would do an evaluation and try to determine what is maybe causing that pain. Is it muscle weakness, muscle tightness? We would do some tests to try to determine the strength, the flexibility of the lower extremities, maybe look at their gait, their running. For instance, at our Center Valley site, we have a lot of kid-friendly activities that we can engage the children with. We have a rock wall, we have a treadmill, we have big light bright stations. We have lots of ways to evaluate and assess that child and then try to determine where their limitations are.
And if it's a kid-friendly environment, it's probably much less daunting to the kids. They probably don't even know they're being evaluated.
Exactly. They think they're just playing.
All right, Dr. Grimm, I'm going to send this one over to you. This viewer writes, my toddler seems to have bow legs. Does this condition in children go away, and when should we be concerned?
Bowed legs in a toddler can be very normal. There's something called physiologic bowing that many children are born with, and you really don't notice it or appreciate it until they get up and start walking, and then it becomes very apparent. Generally, that will go away on its own by around age 2, 2.5. That's what we expect to see. There are other causes of bowing that aren't necessarily physiologic and don't necessarily go away on their own. Things that would make us a little more concerned would be asymmetric, so one side being significantly more bowed than the other, if there was underlying deformities associated, if there was a leg length discrepancy. But generally, this is a very common consult that we get in the office, and the vast majority of them grow out of it on their own.
All right, Dr. Greenhill, this viewer writes, my son fell off the monkey bars and his elbow is swollen. He still can't move it. What should I do?
The most common fracture that children get when they fall off the monkey bars is an elbow fracture. We see them all the time. We're very busy fixing them in the summer if we have to. I would say get that child checked out, especially if the parents are worried. My wife likes to hear me say moms are always right, so if the mom thinks something is wrong, you need an x-ray.
Lisa, I want to turn to you and just ask one last final question. How important is it for parents, moms in particular, I think Dr. Greenhill just pointed out, to follow their gut? What do you recommend for parents?
I have a colleague that uses the quote, never waste a worry. So bring your child in, get them checked out, whether it's by a physical therapist, whether it's by the pediatrician, orthopedic doctor. It's very important to ease your worries because you'll sleep better at night.
So important for parents to follow their gut, and maybe they'll find something that can be treated really easily from some of the amazing techniques you've all shared with us today. Thanks for being here. For more information on pediatric orthopedics at St. Luke's University Health Network, please visit their website at sluhn.org or call 1-866-ST. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for tuning in. Until next time, be well, and remember, it's important to focus on your health now.